Hi all, my name is Alex Frager, and this is the second episode in our COVID-19 series. This episode I spoke with Bobbi, a nurse working in Maryland, about her experiences on the job and the effects of the community on workplace morale. I found through this conversation that I was honestly unprepared for what I learned, and that though hard as some of it was to hear, that it was important. And I hope you, listening now, understand the gravity of what is said, and can learn from it too. But without further ado, let's start the conversation. Hey, how are you?
I'm pretty good. How about you?
Pretty good. Why don't you introduce yourself?
So my name is Bobbi, and I am a critical care nurse at a hospital in Maryland, and have been in critical care for 35 years.
Could you tell me how the day-to-day routine has changed at the hospital since COVID-19?
When we first get to the hospital, we automatically put on our N95 mask and our eye protection, and we wear that all day, and we are required to wear it the whole time we're in the hospital. Hand washing. We're asking the public to do that, but you can imagine that at the hospital, we're doing it that much more. There's no visitors, so that makes it interesting, because anytime we need to talk to a family member, it's done by phone. It also increases the stress level of the patients and the families both, because there's not that eyes-on support that they have. So they get that from the nurse staff.
Could you go into a bit more detail about how all of this has affected families and patients?
They're frustrated. They're scared. We're trying to call the families as often as we can, and they can always call in. But if we're in an isolation room, we can't answer the phone. So then they get mad because we're not answering the phone. So it's frustration on everybody's part. Patients are scared because they don't know what's happening. A lot of times the patients, because they're so stressed, they're not hearing everything they need to hear, even though it's being told to them. You know, when you're under a lot of stress, you only hear about a third of what you're told. Hear and understand. This is a prime example of that.
So across America, there's been a pretty massive surge of support and well wishes toward hospital workers. How have you seen that affect your life and workplace?
Some of the restaurants and stuff in the area are dropping off meals. There's signs for us as you walk into the hospital that issue support. Various individuals, companies, small companies are making face shields and trying to make masks for us and sending in gift bags for the frontline workers. So it helps to know that we're supported. But also when we go out, a lot of times we'll get dirty looks because if we happen to be in our scrubs because we're on our way into work, we get dirty looks from people as well.
Why is that?
They think we're carriers.
How do you cope with being seen like that?
We lean on each other a lot. Unless you're really going through it, you don't really know what it's like. And I'll admit, when I go into work, I'm afraid. I'm scared. Because I work in a high-risk area, a lot of the patients that I see, we know they definitely have it, or we're waiting for their test results to come back to prove they have it. But I know of nurses and frontline workers who have gone out with it already. So we're hesitant. We're scared too, but we have to put one foot in front of the other and keep moving forward.
Could you give me an estimate of how many cases you have in your hospital?
I don't believe the hospital wants me to release that information. I will say there's probably definite cases. There's probably, I would say, close to 50, and probably another 50 that are in the hospital currently that are suspected cases. But here's the thing, then you get into the whole, the patients that have it, or the people that have it that show no symptoms. So that's another area of concern we have.
People across America have begun sewing masks, and companies have kind of changed production to equipment like ventilators to help support medical staff. Have you all seen any of that, or is it going elsewhere?
There's like small companies in our area that are making face shields for us and dropping them off. They may drop off 50, they may drop off 100, they may drop off 10. So yeah, we are seeing that within the hospital, and it is so appreciated. You have no idea.
If people do want to help, what can they do?
First and foremost, follow the CDC guidelines. Social distancing works. Wear a mask when you're out in public. Hand wash, hand wash, hand wash. That's so important. Don't touch your face. I mean, they talk about flattening the curve. And to a certain extent, we are flattening the curve, but we're not flattening it enough. People are still getting sick. Check on your neighbors. If you're going to the store, send a text to your elderly neighbors and say, I'm running to the store. What do you need? You know, that kind of thing means a lot. I think we need to support each other as best we can while maintaining what the CDC says. If somebody wants to help out the hospital, if you want to send care packages and stuff like that, yes, it's appreciated. You know, we got to eat too, but we can also only eat so much pizza. So like fresh fruit, granola bars, stuff like that is appreciated. Absolutely. Anything is appreciated.
And then is there anything else you'd like to add?
This is a scary time. Scary time for hospital workers, but scary time for everybody, really. This is I think this is going to issue in a new normal for us, kind of like 9/11 did. And it's gonna institute some changes. I'm also concerned about the mental health effects of this. I think once we get through this part, we're going to see a surge in mental health issues, clinical depression, probably suicide. I think that's coming as well. And that has me concerned because we've been in a mental health crisis for probably years. And I think this is going to really bring it to the forefront. I'm tired. It's not just the physical work, but it's the emotional and the stress. I'm tired. And we all are. We're all tired. The administrators of the hospital are completely wiped out. I mean, they're trying to do what they can. And I have a great deal of respect for them right now. I've seen people die from this. It's not just the elderly or the people with other comorbidities that are dying. There's young people dying too. Though for you, 40 might not be so young, but patients in their 40s are dying. Patients in their 30s are dying. And these are patients that are other normally healthy without any comorbidities. And that's scary. That's very scary. And I don't know what else I can say. It's our new reality. I'm afraid it's going to come to the point where we have to triage patients with regards to some of the life-saving equipment. And I know they're already talking about it in New York State, where, you know, if somebody's getting sick, you have 3 people that are getting sick, they have to decide which one gets the ventilator. And that's hard. We're in this country, we're not trained to do that. It's kind of like battlefield medicine. It's a new normal for us in the medical field. I hope it doesn't come to that in Maryland, but it could.
Well, thank you very much, and also thank you sincerely for everything you do. And thank you, the listener, for joining this conversation. If you're looking for more conversations about COVID-19, you can check out my website at fregernews.blogspot.com, as well as follow me at my Twitter at Alex Freger, AlexFregger, and my YouTube channel, Alex Freger. A couple of thanks are in due. I'd like to again thank Bobbi for taking the time out of her day to talk to me about this issue. I'd also like to thank Daniel Solomon for the music and Paulo Sayo for the art accompanying each of these episodes. Also, please feel free to continue this conversation in the comments below. Until next time, stay safe out there.